Welcome back to the New Year's Day edition of the chat on News Channel 10 and on Newsday Amarillo. I'm David Lovejoy, joined this beautiful New Year's Day by the beautiful Miss Shannon Gray. Chuck, you're not that bad looking, but
But
he's joined us
hey,
from News Channel
hey,
10. He's got that whole Richard Roundtree
Sure.
Shaft thing going here
Come
hey,
on.
today.
Chuck said the other
Yeah.
day, he said, I've seen Shannon look her worst like 100% of the time. So
d-
today's the new year. I wore nice makeup,
See?
Chuck. You're
See how that
welcome.
well,
works?
hey, no,
Right now,
see, you see, hey, that Chuck, he's a bad mother. Hey, watch yourself, boy.
I know it. Well, unfortunately, I don't think anybody in this room has problems with holiday downside to it and having a good time. But there are a lot of people who struggle
Right.
during this time of the year. A lot of factors go into that. We've got Dr. Myles Spar. He's the chief medical officer of Vault Health, and we're going to talk about some of those holiday blues. And one thing I heard about the other day, and it kind of blew me away, is the New Year's expectation. We put so much hope into this new year, and after a week or so, we're kind of downtrodden. It's another week of the same thing. Welcome, Doctor Spar. Happy New Year.
Happy New Year. Thank you. So good to be here.
Now you're the chief medical officer of Vault Health, and
Right.
and we talked about all these issues, holidays, elections, economy. What consistent shred makers make it hard for men to live in this society right now, to get along?
Yeah, well, like you said, it's a stressful time. We specialize in men's health. Vault is a national medical practice that specializes in men's health. And we're finding it's a stressful time for everybody, but especially for men right now, it's really hard to understand what does it really mean to be a successful man. The idea of masculinity has kind of changed over 2020 as a result of a lot of factors, including the stress of COVID and men feeling like they need to be the provider. And that can be more difficult for a lot of people because of issues financially with 2020. So I think the stress of needing things to change in a good way, and yet the changes have been unexpected and out of control has been really, really hard for people, that lack of control.
Yeah, and I think a big part of that right now is the stress on couples, especially when we look at really kind of segregating ourselves from the world and possibly even each other, depending on the situation right now. What are the factors that go into even feeling disconnected? Is that a hormonal thing, or is it a science based thing, or is it just, made up?
No, great question, Shannon. It's true. We think, well, we're having so much together time, it's going to be great,
Yeah.
but too much together time can take the romance out of it a little bit,
Right.
because then you don't quite, have as much of that kind of expectation and excitement and surprise because it's just day in, day out, the same thing. And it absolutely can be hormonal. And it's not all in your head. Some of it can be hormonal like testosterone because, stress lowers testosterone levels, which is hard to really think about. But you realize, we think about women whose menstrual cycles get messed up if they're under a lot of stress. Well, guys don't exhibit changes in menstrual cycles, but it's all because sex hormones get imbalanced when you're stressed out. And it's kind of like evolution. It says, okay, there's stress. Let's not focus on sex. Let's focus on managing whatever this crisis is. So your brain says, we can't be worrying about sex right now, but then you don't feel like having sex. And so looking at your hormones, considering even adding to your hormone levels if they're low, or even taking other things we can talk about that can help boost that connection can really help.
Doctor, let me ask this. How much of this stress is actually, uh, how much of the stress can be placed on the issue of traditional thinking, male, female way of doing things? Like, okay, I'm a male, I'm supposed to be able to lift a freight train, but a female's supposed to sit back. How does this play into that, or does it still play into that? Don't we have to get rid of a lot of the old way of thinking, if you will?
Absolutely. A lot of it, I think it's that male idea that it's all about being stoic. That's older, old fashioned, harmful, I think, sense of being a man means being tough and not seeking help. And that means guys don't get their testosterone checked or even their blood pressure checked or go to the doctor. Guys are less than half as likely to go to a doctor as a woman is because they feel like I can handle it. Even though I'm having a little chest pain, I'm not going to worry about it. And obviously that's dangerous. And so I'm hoping 2021 is the year of, okay, no, actually it's smart to seek help when you could use help. Look at sports figures who use coaches. They don't hesitate to get managers and trainers and coaches for help. And those are people we look up to. And so you can see it's not a weakness. And yes, I think we need to change that idea of masculinity is all about doing it on my own.
So, a brief follow up. So, basically, you're looking towards 2021 as being a case of awareness
Yes.
between men and women.
Absolutely. Awareness and communication. That's the other part of it. It's about, like David mentioned at the beginning, it's managing expectations. It's like, what are you expecting out of 2021? What are you expecting out of the relationship? What are you expecting sexually? What are you expecting that we should be doing tonight for dinner? It's not about assuming your partner knows what you want in all these different situations. That makes a giant difference to decrease the stress.
I tell you something that has struck me during this conversation is we've gone through a lockdown here in Texas. Of course, New York has gone through phases of that, and it drew us closer. But sometimes you can be in the same room with someone and you're far apart
Far apart.
because of what those mindsets are, what's important to you and what's important to, let's say, your partner. What things, Dr. Spark, can we do to kind of bridge that gap, pull us back together, to
Yeah,
be there
absolutely.
for each other?
Yeah, well, certainly the communication issues we talked about, and there's even we have all actually have some what we call kits that can help. For example, there's a hormone called oxytocin, which we make naturally. That's a bonding hormone. It's what's released if you hug someone for kind of an uncomfortably long period of time, like 30 seconds. And it also gets released when a mother gives birth to a baby to help with that bonding. And you can actually take oxytocin as a nasal spray, and it helps boost the sense of bonding to your partner. It's safe, it's well studied. It's a part of a kit that we have that includes other things that just help you feel a little more connected to your partner. So that's one way that can really help.
Are there actions that we can take aside from, natural remedies? Like you were talking a lot about hugging. So, I mean, literal physical connection is a big part of this, right?
Absolutely. Physical touch is huge. Connecting physically, looking into each other's eyes for a few minutes. I think one big thing couples can do, because we're so busy, even though we're together, we may not be connecting. So it's physically connecting, like you said, Shannon, but also saying, you know what, every day we're going to take 5 minutes, just stop, and I'm going to really be present for you, phone away, social media away, and just really listen to what's on your mind. And
Mm.
that's the key question is, what's on your mind today? Because a lot of us don't get anyone to ask us that or even
Hmm.
care to hear that, and that literally could be 5 minutes for each person every day, so it's a total of 10 minutes. Just say, okay, here's our 10-minute precious time. Kids are doing something, TV's off, phones away, tell me what's on your mind today. And that's huge.
Is, in your opinion, is the digital age standing in the way of connection, or is it helping connection? In your opinion, sir?
Good question. I think it's both. I think it definitely helps in a way because, we couldn't have done this interview because I couldn't have flown to Amarillo for
Yeah.
this, right? And
Right.
there's a lot we can do. And I'm part of groups with other guys that are men's groups and other groups that are with people from all over the country. So that's great. But there's still a little bit of something lacking, right? Not being in person. There's definitely an energy of being together in the same room. So I think on one hand, yeah, we're able to connect with people all around the world that we couldn't have otherwise digitally. But on the other hand, it's the phones are really taking us away from the people we are with physically. And it's an addiction in a way. It's
Yeah.
that dopamine rush. I'm sure we've all heard, all your listeners have heard that every time you get an email or a ping or a notification, it's a little bit of a dopamine rush related to addiction to drugs. It's the same chemical in the brain that gets stimulated. Oh, somebody wants to tell me something. Oh, there's something interesting. And that part of the digital life is really distracting from connecting with the people in person. So we got to set limits and be more disciplined around that part of it.
One last thing from us, doctor here. As men and women, at a young age, we started being groomed to fill a certain role.
Role.
What a man is, what a woman is,
Yeah.
and the man's supposed to be John Wayne. He's supposed to be the tough guy out front, da da da. But he's also supposed to suffer in silence.
Yes.
He's not supposed to show his emotions. He's not. One of the things that drives me crazy when I work with children and they say don't cry, or they pat a boy on the head for not crying when he's broke his arm or something, and I'm like cry because it hurts, cry, it's okay,
Right.
man. And how do we change that and make the man, like you said, you focus on men's health and men's issues. How can we start making it okay to ask for help or to say, hey, I'm not doing too good here. I'm suffering here. How can we do that, sir?
Yeah, that's a great question. I mean, it's challenging. It's just funny you just brought up John Wayne. I have this shot glass that got but it's about changing what he represents. I keep right next to me, and it has a quote for him. It says, "A man's got to have a code, a creed to live by,"
That's
which is
Right.
true, but it's a different code than he was talking about, right? It's a code about just what you're saying. It's a code about being more communicative and more open. And I think it's just I don't know how the quick way to do that is. One trick I find that help guys kind of open up a little more, that's gotten a little more popular, are things like breath work and mindfulness, and there are apps for that. And I know it sounds unrelated, but it actually helps you to kind of observe yourself a little bit and not just be like in your head all the time. You
Mhm.
learn to control your thoughts and don't let your thoughts control you. And just doing 10 minutes of like breathing and just focusing on your breath can help you realize, okay, you know what? Let me think with the smart front part of my brain, which is the part that's the most evolved, and realize, yeah, getting help for this isn't weak. It's actually going to make me stronger. And it gives you a more rational sense of thinking. But when you stay in that primordial, stressed out part of your brain that isn't that frontal lobe part of your brain, that's the kind of like, no, me man, me not, seek help. So it's about figuring out a way to listen to the more executive frontal lobe part. And that's where breath work and mindfulness practice can really help.
Mm.
Doctor, thank you for some great advice today to start our new year on. And like I said, that's sometimes it's an issue as men we avoid. Like I said, as a veteran, a soldier, you say, I can do it by myself. That's what you're trained to do. I can do it on my own. I can do it on, I don't need your help. That's not true. Not in today's world, especially after COVID in 2020 and just the day to day stresses. So, where can they find out more about this information, Doctor?
Sure, go to vaulthealth.com. You can sign up for a newsletter every week. It's a really quick, just a few bullets on really important resources that can help guys out, or schedule an appointment to talk to one of our men's health specialists. It's hard to find healthcare practitioners that really get guys
Hmm.
and know, do you need your testosterone check? Maybe that's the issue. Do you need some of these other kits we have? So it's a lot of good information. There's a blog on there. So I would say start with our website.
All right, we'll put that information on both News Channel 10's website and on ours here at KGNC. Dr. Spar, would it be too presumptuous to say we want to invite you back on next month and we'll talk about some other issues?
I'd be happy to. I love it. I love Amarillo. When I moved out here from California, we stayed in Amarillo for a couple nights and went to that place where if you eat like the 16-ounce,
The 72 ounce.
Yep.
You went to the Big Texan, man. That's the Big
That's
Texan.
it.
Our
big,
claim to fame.
yeah, I didn't try it, but
Most locals
That's
don't.
probably not on the list of
Yeah,
things to do. Yeah.
No.
Absolutely. Thank you.
Talking about men's health. You know what I'm saying?
Yeah.
No,
Don't do that. Yeah.
don't do that one. Thank you, Dr. Spar. Happy New Year, sir. We'll see you next month.
Yeah, all right.
All
Sounds
right.